Hello, hello, hello. Welcome back to my channel. It is me, it is I, it is she, it is her, it is who? It is Rosie Rosette 2020. Listen, I need who? I'm sorry. I said who it was. Oh my god. It's Rosie Rosette 2020. Pow. Is that better? Okay. Anyway, let me get this cough drop because let me tell you, when I tell you I've made about 10 videos, 11 videos, I have. And, oh, sorry. My voice is getting a little numb. And excuse me, I think this is like in poor taste, but I'm gonna do it anyway because I keep looking at it. And I need to put on some lips. When I tell you I've just made 10 videos, please believe me. So let me just put that on a little more. Okay, here we go. Here we go. All right. Okay. So thank you. Um, this video is just about my progression in preparing for my surgery. Although I've never made a date, I think I picked a doctor and I'm about to make a deposit. I'm kind of scared because, I think this is going to happen finally. I've been wanting this for at least 12 years. I always said, but even when I was younger, in my 30s, 20s, or 30s, I said once I turn 50, if I don't have the shape that I want, I said this 30 years ago, I'm getting a tummy tuck. I think I said I'm getting a mommy makeover because I don't want to be that 65, 75-year-old woman and people are like, whoa, you really let yourself go. Someone, excuse me, I'm sorry, I like them. But someone has already said that to me. I was like, oh, okay. Of course, people who say that. They don't have a picture on their ID or, whatever their channel, whatever they're talking about. They always have some abstract picture of something else. You know what I'm saying? But then they want to talk shit about you. But that's okay. That's okay, honey. Because they're fans. Because I don't even know who you are. You know what I'm saying? You don't even have pictures of it. You want to talk shit about me. And that's okay. That's okay because obviously I'm doing something right. You know what I'm saying? Or else you wouldn't be here talking shit. Anyway, for 51, honey, I look awesome with or without the makeup. Okay? For my age. For my age, okay? Anyway, back to the surgery. Um, I'm a couple. No, wait. Yeah. I'm $1,000 away from having the money for this surgery. For all the money for the surgery. Now, once you have all the money for surgery, you have to have money for the plane ride. You have to have money for the recovery house, which I want to stay a month or 2 months. You know me, I'm gonna be extra. Um, I don't want to come back until I'm like normal. I can walk normal. I know that my stitches are clear. That I'm not trying to have no infection. I'm trying to get as many massages as possible. Like, I might move from a recovery house to a hostel or, to an Airbnb. That's what I'll probably do. I'll probably spend the first 3 weeks at a recovery house and then, like and then the last 2 or 3 weeks, like 3 weeks at a recovery house, 3 weeks at an Airbnb or a hostel. That way I can like spread my money out and, do stay a little longer, continue my massages and not pay, that much money. Because honestly, I don't like, I don't like, I don't want to pay that much money when I move back, or not move back, come back to the States. They charge like $100 per massage for a lymphatic. Is that what it's called? A lymphatic massage? I don't want to pay that much. I don't. I don't want to pay that much. And, that's very costly. It would be cheaper for me to stay, in wherever I go and get the massages for a third of the price. Now, I could probably get them for an eighth of the price if I buy enough, massages or whatever. Come back, I'm healthy, I'm well maintained, get my fajas, make sure that my wounds are sealed, make sure that all the drains are out, stay local near the doctors so that if there's anything that's going on, they can take care of it. They can take care of it. Because when you go, you have to buy extra insurance. Okay, if anything happens to me, they can take care of it. See, people want to get the surgery, get a BBL, get a tummy tuck, get a mommy makeover, give it a breast thing. Then they want to rush back home. I don't even want to get on a plane until I can walk, even though, I'm going to get the wheelchair and everything. But I don't want to go anywhere near a plane until I can walk up straight and be able to get up and, not have to sit on the boppy pillow, is that what it's called? On the airplane looking like a fool, all the bandages and everything and looking like, some 80-year-old or something like that. No, honey, when I come home, I want to be able to walk, talk, act, eat, whatever. I got to be able to have my sexiness, um, my physique. I just need to be able to be normal. And I think I would be able to do it better over there, where if I'm catered to for 4 weeks and then I'm on my own for another 3 weeks just getting massages and everything, I think that would be the deal. That would honestly be the deal for me. Because I noticed, because I've had a few operations, one on my ankle, two on my shoulder, one on my ankle. Is that it? Oh, and then I had a no, and then I had a hemorrhoidectomy. So that's a procedure. The best thing that you can do, even when you don't get an operation, the best thing that you can do to heal your body is rest, is sleep. Let me tell you, if I don't get my sleep, oh my God, I'm so emotional. And I feel so sorry for the people that I'm around when I'm just exhausted. I'm so emotional. And it's just not right. It's not fair. It really just is not fair. I'm a person, I really need 6 hours, at least 6 hours, 6 to 11 hours. I'm not lying. And I know, once I recover, in my recovery, you just have to have the right pain pump. You have to have the right meds. You have to have the right faja. You have to have the right bandages. You have to have the right masseuse. You have to have the right, caretakers. Everything has to be aligned correctly so that when you go, you can come back alive and well. Not just alive, but you need to come back alive and well. So it's just important to me that I save up, and I'm so proud of myself for saving up. I've never aggressively saved like this. Never. It's not that it's not like I need anything. So at this time in my life, I don't need the fancy cars. I don't need the designer handbags. Not that I don't like them, but I don't need it right now. What I need to focus on, because I want to get this stomach together, flatten, so I have to exercise and trying to kill myself. And then, what are all these cards for? And then I need to start focusing on my financial and my portfolio. That's going to be my next agenda. I want to get this out of the way so that I can start saving towards my empire and make money for my empire. Um, yeah, so that's the game plan. Drop down if you guys have any suggestions, any great doctors, if you guys want to put up any pictures. My Instagram is Rosie Rosette 2020. If you want to DM me with any suggestions or any pictures, I want a tummy tuck. And I have a nice size butt, but I want an upside down heart. Yeah, because this is right. So yeah, I want that. That's what I want. I want upside down, but just like that. And a flat stomach. I'm not really tripping off of the butt, because if I never, I can handle my butt, but The stomach has to be right, and I want my hips shaped. Or what are they, lats or whatever? Anyway, and I'm already knowing that I'm gonna have to go for a round two, because you get the tummy tuck, and then you have to go back, and because you're not supposed to get lipo when you get the tummy tuck. You're not supposed to do that. So I'm gonna get the tummy tuck, and then I'm gonna go back, you know, maybe a year later, and get it lipo so that it can be flat, because I'm noticing that people get the tummy tuck that is still a little, it's a lot of fat around there. It's flat, but it's not, you know, boardwalk flat. You know what I'm saying? So this is my journey. I'm putting in. I know I make a lot of videos about everything, but this right here is very important to me. So that being said, you know, this is like my first official video. Like, okay, February 14th, 21. Let's do the countdown. I need to lose another 40 pounds. I'll say 30. If I lose like 7 pounds a month from this month up till June or July, I'll be good. 7 pounds a month. That's okay. Yeah, 7 pounds. Okay? All right. See you guys later. And thank you so much for starting this journey for me. It's going to be, the next, 12 months, because I'm planning on getting the surgery in July or August. And then, so you have to do the pre-op and then the post-op. The post-op is most important. That's when you guys are going to get the most of the videos, because I'm going to be wherever I'm going to be. I don't know where I'm going to be. I might be in Europe. I might be in Mexico. I might be in the DR. I might be in Colombia. I'm not exactly sure where. But that's where the bulk of my videos, leaving, doing the pre-op. But the post-op is what I'm most concerned with, because I don't see a lot of videos regarding that. Just very few. Very few. I don't know if I'm going to make another channel just to focus on that. I don't know if I'm going to, insert it into this one. I'm not exactly sure. But you will have a 51-year-old woman going through it. So I hope that in these future, videos regarding plastic surgery, that anyone of my age or older, that you guys will, jump on the bandwagon. Okay, I'll talk to you guys later. Bye.